Personal protective equipment, known as PPE, should be worn to control exposure to hazardous chemotherapy drugs, both oral and parenteral. Appropriate use of PPE is the nurse's professional responsibility. PPE includes gloves, gowns, respirators, and eye and face protection. The gloves you wear should be disposable gloves that are powder-free and have been tested for use with hazardous drugs. Gloves made of nitrile, polyurethane, or neoprene may provide protection. Inspect the gloves for physical defects before you use them. Wear a disposable, lint-free gown made of low permeability fabric such as polyethylene-coated materials. The gown should have a solid front, long sleeves, tight cuffs, and back closure. The inner glove cuff should be worn under the gown cuff. Gowns are meant for single use only and should not be reapplied after removal. Double gloves are recommended for all handling activities. The second set of gloves should be worn over the first. The outer glove cuff should extend over the gown cuff to fully protect the skin. Remove and discard gloves immediately after use. You should also remove the gloves immediately if a tear or puncture to the gloves occurs while wearing them. Do not wear gloves for more than 30 minutes. Additionally, change your gloves immediately after addressing a hazardous spill. PPE should be used when preparing IV bags, changing and priming IV tubing, handling leakage from connection sites, disposing of drugs and contaminated items, handling patient's body fluid, handling oral drugs. NIOSH-approved respirator masks should be worn when there is a risk of aerosol exposure, such as when administering an aerosolized hazardous drug or cleaning a hazardous drug spill. A face shield or a combination of a mask and face shield that provides splash protection should be worn whenever there is a possibility of splashing, for example, when administering intravesicular chemotherapy.